Each year here at Boomer Benefits, we teach tens of thousands of baby boomers how to navigate Medicare. I'm Danielle Roberts, and in this video, I'll show you the parts of Medicare and help you determine which parts you need and which parts you may not need. Be sure to stay until the end so that you can download our free New to Medicare checklist. Something I often see with new Medicare beneficiaries is that they get bogged down trying to learn about Medicare supplements and Medicare Advantage plans before they even really understand how their original Medicare benefits work. It's important not to put the cart before the horse, so let's start by learning the basic parts of Medicare. First and foremost, let's talk about parts versus plans. Medicare itself has parts, just 4 of them. When we use or hear the word plans, then we're typically talking about supplemental coverage or Medicare Advantage. So remember, Medicare has parts and supplemental options come in plans. Medicare Part A is your hospital coverage. You want to think about this as your room and board in the hospital. It's going to pay for a semi-private hospital room, including 3 square meals a day and doctors and nurses who come around to care for you. It's also going to take care of any skilled nursing facility care you may need after a hospital stay, and Part A also covers hospice and blood transfusions. Part B is your outpatient medical coverage, and this includes things like doctor visits and lab work, physical therapy, medical supplies. But it also covers some things that may happen in a clinical or hospital setting, including outpatient surgeries, ambulance rides, diagnostic imaging, dialysis, chemotherapy, radiation. So to be sure, if Medicare is going to be your primary health insurance coverage, you can't get away with just having Part A. You'll need both Medicare Parts A and B together. These 2 parts make up your original Medicare, or sometimes what we call traditional Medicare. When you are enrolled in original Medicare Parts A and B, you can get your inpatient and outpatient care from any provider in the nation who accepts Medicare. And there are more than 1 million Medicare providers, so you will have a lot of great providers to choose from. Now, just like health insurance that you've had when you were under 65, Medicare Parts A and B have deductibles and copays and coinsurance that you pay as you access healthcare services. If you stick with original Medicare Parts A and B, you can choose to enroll in a Medigap plan, sometimes called a Medicare supplement, that will pay some of these things for you. Let me also mention that when Medicare was first rolled out back in 1965, Parts A and B were the only 2 parts of Medicare in existence. And still today, they are the only 2 parts that you will sign up for through the Social Security office or website or the Railroad Retirement Board. The other 2 parts of Medicare, C and D, came later, and both of these are optional. Let's take a look at how those work. Medicare Part C is also called the Medicare Advantage Program. This is a voluntary form of coverage where you can choose to get your Part A and B healthcare services and sometimes Part D benefits through a private local health insurance network of providers, such as an HMO or PPO. To qualify for a Medicare Advantage plan, you must be enrolled in both Medicare Parts A and B and live in the plan service area. Since this video is about the basic parts of Medicare, we won't get into the details about Advantage plans today. But we have several other videos here on YouTube where you can learn how they work and what the pros and cons of these plans may be. For the purposes of this video, however, it's important to note that since not everyone wants to get their benefits through a Medicare Advantage plan, Medicare Part C is optional. So some people choose to enroll in one, and others choose to stick with original Medicare Parts A and B. The last part of Medicare is Part D, which is optional prescription drug coverage that you can purchase to help cover the cost of any outpatient medications you may take. Part D is voluntary and not everyone needs it. For instance, some people may have veterans benefits and choose to refill their medications only through the VA clinic, or they may have some other form of creditable coverage. If you don't have any other creditable drug coverage, you will want to enroll in Medicare Part D when you're first eligible, because otherwise you will begin to incur a late penalty that grows larger with time. So there you have it. Today we have learned that Medicare has 4 different parts. There are 3 parts that cover hospital, outpatient, and drug coverage, and 1 part which is simply another way to access your Medicare Part A and B and possibly D benefits. Now for a deeper dive on what Medicare covers and costs, and to begin learning about your supplemental options, find the link to my blog post below, 4 Simple Steps to Understanding Medicare. On that post, you can download our free New to Medicare checklist designed for people who are turning 65. And finally, if you enjoyed this video, be sure to hit the like button, share it with your friends, and subscribe to our channel for more news and information about Medicare. Thanks for watching, and we'll see you in the next video.